preserve reproductive rights generally, please do that. Please speak up. Please, find those resources in your community that you can get involved with to kind of elevate this issue. Thank you for the question.
I would like to piggyback on the medical part. I've read the book by Washington. It's excellent. And she has videos on YouTube as well. But I work in the health field and work with a lot of doctors as well. And it's sort of taught that black people, or I don't like to use the word people of color or whatever, but black people or brown people, they don't get the treatment. So in my aspect is that we need to start holding accountable the healthcare professions. Mm-hmm. The only reason why that people of color or black people aren't affected by the opioid crisis is because doctors thought that black folks was going and use the drugs, so we didn't get it. So it affected us. That's not something that I made up. This is what the professionals are saying. But we need to start holding our doctors accountable as far as the way they treat us. I work with Medicare as well, and an insurance aspect with I have over 500 clients. And when I work in the black neighborhoods, when they go to the doctor, they don't get the care, or they may need it. They may need an MRI, but they're going to get an X-ray, or the insurance company will pay for it, or they're just popping out pills. It's just a pill mill for a lot of them. And I've had to take my clients to the doctor and literally just go off in the place about what they're doing. So we need to hold them accountable, especially for the seniors who are not vocal. And a lot of seniors and a lot of people just think doctors are gods.
Right. So one of the first things that, one of the best things that I've seen on Facebook or Twitter, or one of those places, was someone suggested that when we as black women, or anyone who is not being treated properly by a medical professional, feel that we're not being treated properly, ask them the simple thing of, okay, so are you refusing to treat me for this? Can you please document that in my notes? That simple request, document it, document everything. And sometimes it'll turn around. Sometimes it won't, but at least if it doesn't, you have that documentation that they refuse to fully treat you. That's one for self-advocacy. The other thing I was thinking when you were speaking was, I lost it already, sorry. But documenting the other thing is, so in my former profession, I was a pharmaceutical rep. Doctors are not gods. They don't know everything. I was shocked. I was in that industry for 12 years, recently laid off. I was shocked as a first-year rep going into an office and explaining to a doctor about the drug that I had studied for about 3 weeks to 6 weeks, actually 3 to 6 weeks, depending on the company, and explaining to them how this drug worked, what pathways it worked in, being more of an expert on that chemical than that doctor was, and them listening to me and believing me. Now, of course, I was telling the truth. I was telling, what I had studied or trained on, what have you. But it was shocking to me just to go in and say, this is a doctor that's been studying for 10 years at least, and I'm telling them something that they're looking at me like, oh, you're very knowledgeable about your product. Yeah, but you're a doctor.
But they only require you 8 hours of pharmacology, so.
Exactly. So that's when I learned that medicine really is an art. It is not a science. Most doctors, I gotta go. Most doctors are just winging it.
Yeah, they are.
Thank you. I have been summoned.
Okay, Rajani, I seen your hand, and we have 3 minutes, so can we get the question out and get it answered in 3 minutes so that we can get it broken up for the.
We can do it.
Okay, go ahead, Rajani.
Sure. Feminist seems like a really white supremacist term to me sometimes, and I don't like to say it because it feels like I'm like just with white women.
Okay.
So I'm wondering if you feel the same and if there's a different term you'd like to use. Thanks.
Nice.
So there is the term womanist, but that is a black term, and I do not feel comfortable using it for myself.
Right.
But I always say I support womanist circles. I use feminist for myself because I feel like that's, but I mean, the problem though, I feel like sometimes is like term creep, is like, at what point do we stop fighting for a term? And at what point do we give up on the term versus what do we say, no, we fight for inclusion in the term? So I know that depends on the person, but I don't know.
I don't like the word feminism, but for other reasons. I think the real feminists came way before my time. They did a great job, and that's why we're here today, and they deserve that term. And I also don't like when the term is used for some white women that sit behind a computer typing about feminism, and they call it feminism. So I prefer, even intersectionality, because it's such a, to me, intersectionality is something that colors your life experiences. So I much rather even go to that word, which is not also a favorite word, but I think any name, I'm more open than feminism, because I really don't feel that I was in the early fight for that, to be using that word.
Okay. And on that note, the panel has concluded. Thank you, Deanna. Okay, so, Andy, okay.